my main takeaway, we're upstanding citizens. Tony, kind of a derelict.
Absolutely.
Great. Outstanding.
1, 2, 3, 4.
Hello. My name is Tony Chinqui.
And I'm Frances May Harden.
And welcome to Social Rounds, the podcast in which two of the happiest surgeon dropouts you'll ever meet give our unsolicited opinions on the states of medicine, the world at large, pop culture, and whatever else we happen to find interesting. So, we have a very special episode today, and I want to tee it up. I'm going to bring y'all back. Okay, so several episodes ago, we interrupted our regular ill-tempered yapping for a rare moment of good news. So we hit you guys and ourselves with a little moment of inspiration, right? In the form of a story of a med student who had this full circle moment, found herself working as a doctor in training at the very hospital where she'd previously worked as a janitor earlier in her life. And, we all loved it. Very life affirming. A short while after that episode, that student reached out to us online to say thanks for sharing her story, despite this affirmation that we are the most influential and popular podcast in modern history. We were super touched by this, right? After an extensive vetting process revealed we weren't getting catfished by this person, we asked her to come and hang out with us on the show.
Woo!
And here she is. Shay Taylor is here with us. Shay, welcome to the show.
Thank you. That was quite an introduction.
Welcome, Shay.
I love an introduction.
You love a good one. Thank you for having me. I'm so excited to be here.
Yes, absolutely.
It is a big deal. It's true that Tony's a yapper, but it is a big deal because frankly, like when we got to connect with you, this is like Tony's celeb meeting of 2026. It's a big deal. The equivalent would be I was very inspired by Josh O'Connor, Q4 of 2025. And I talked about him a little bit on the podcast. So it literally would be like if he somehow was like, this is cool. Thanks for the shout out on Social Rounds. And then we got to meet Josh. So I'm trying to manifest that for me. Tony got to meet his celeb.
I'm living my dream right now. I mean, this is outstanding. And Shay, so you are currently a fourth year student.
Yes.
Are you at Howard?
Yes. Mm-hmm.
Excellent. Strong program over there. And what's the life plan? What do you where you at? What are you trying to go into? What's happening?
So we're in our fourth year. So I just finished interviews, of course. But I'm trying to go into anesthesia.
Okay.
I found
Excellent.
like very last minute. I think kind of like towards the end of third year that I thought anesthesia would be a good fit for me. So I going full course with it. I couldn't figure out for a long time what I wanted to do. But once I fell in love with anesthesia, I was like, okay, this is it. So that's what I'm going for now.
Anesthesia is a strong choice. We as surgeons approve, I think.
Yeah, I was going to say, I feel like anesthesia has like the best personalities. Like everyone I know is pretty chill.
Mm-hmm.
And anesthesia, occupational yappers themselves, I feel. Y'all got to keep it going.
Yeah, I just feel like we get like this kind of thing where people is like, oh, you guys don't talk to patients enough. And it's just like, you can't be that type of person that likes to talk a lot. But that's not my personality. I'm definitely a certified yapper. And I felt like when I was rotating, I still got that chance to talk to my patients.
Mm-hmm.
So I know we get that notion that we don't, but we definitely have time to talk to our patients before the operation. So I definitely love that part.
And
100%.
I love that. That's a good PSA for all the kids out there. Okay. Like you're not just looking at sleepy patients all day.
Exactly.
Yes.
Last
when
procedure.
patients are sleeping, you talking to us and we having a good time.
Exactly. No, I think that my last procedure, I remember anesthesia like more than even the doctor. I probably spent more net minutes with anesthesia than with the doctor.
That's good to hear because at first I was kind of like, I don't know if this is going to be for me and my personality, but after a while I got to see I have that time. So anybody who want to do anesthesia, a certified yapper, I think you still should go for it.
Yes. Yappers unite. This is great.
Here's my question. Is it true that you have to like math?
I wouldn't say that you have to be like this mathematician where you have to just be in love with math and that had to be your first love, because that was never my first love, of course. So I don't 100% believe that at all. At all. I don't think you have to be in love with it. Do you have to know your numbers? Of course, you have to know math when it comes to anesthesia, but to be in love with it, I don't think so. It's something that you can learn along the way and get better at it as you keep improving and keep doing it after a while. So
This
I
is
love
great
that.
because we skew heavily surgeon around here. And so all these stereotypes of other specialties, remain in our heads and perhaps in the heads of our listeners. But we're not about that. We trying to broaden horizons around here. So you
of
need to
course.
know as much math as you would in any other specialty, I
Of
guess is
course.
what
No,
we're trying to
Maybe a
learn.
no,
little more.
more.
Maybe a little
You
Tony,
think
more.
you have
more?
to know more math. She's just
You
saying you
sure?
don't have to have loved it from a young age.
Yeah. I
Okay,
think a
so you
little
need to
more,
a little more.
maybe.
You need to be advanced class, but you don't need to be like you don't need to be nephrologist math.
Yep.
Because in
Tony,
my
you're
head,
literally
nephrologists are like doing math all the
The
time, like
mathematicians out
kidney
here.
math.
I
Or is
think
that or is that is
you
that
know some
false?
math.
I don't know.
Yeah, Tony took
Okay,
that way too
Francis
far. Tony
May,
was like, "What's up,
Yeah,
guys?
he's
You
like,
don't
no,
need to know any
you don't
math."
gotta know math at all. You can do
He's
anesthesia
like,
with
"Skip
absolutely
math
no
class.
math.
Don't go
Somebody
to
will tell you how to
school."
do it.
yeah,
Yeah, no, I'm pretty sure anesthesia, like, they just need to have a good handle on their math skills. Like I'm saying, as an ENT,
listen, I was saying baseline med students are good at math anyway.
Mhm.
Like, you don't have to be especially good at math as a med student who had to be good at math to get into med school in order to be an anesthesiologist. Right? Can we
yeah,
agree?
right,
Yes, I
Everyone,
feel
of
like that you
course.
don't have to be a true mathematician. You don't have to be going to these, I
I
don't
think we're
know,
saying the same
maybe.
Yeah,
thing.
you're not doing differential equations when you are doing your
Right.
job. Like, I assume that's not what Shay's showing up to every day, but for sure, like, definitely, I agree with you, Tony. My math skills were just like totally legit. They were on par in medical
Like
school, and then like,
we hitting the baseline, which is
but
high,
during ENT
but
residency, they just like rotted away. Like once a year, I
Yeah.
had to
correct.
calculate maybe like a peds lido thing, and
Not here
then
for that.
maybe diluting Botox. That's the extent of my math. Those skills
Yeah,
did
that's
rot away
real.
from lack of use.
Yes. So I'm glad some of us are still here with numbers, decimal points and the like. So that's great. I also wanted to point out, Shay, I saw that are you the vice president of your class?
Yes, I
So,
am. I'm the vice
so
president.
that's great. We share some political DNA as I was a vice president in my med school class, and I
Good. I
wore
love
that
that.
with enormous pride. Um, so yeah, I just wanted to shout that out,
Yeah.
lest it go unknown. Francis May, you look starstruck. So
Two
that
vice
is
presidents in
two
one
vice
recording?
presidents. I mean,
In
mhm,
one meeting.
you are
Yes.
you are correct to want to kiss the rings right now
N-
because
No,
these are the responses we're used to.
it sounds so bad because I was smiling to be nice. I had no idea that there was a
You're
student
such an
council
asshole.
in medical school. I have a president and vice president?
Did you?
You should have.
You should
You
Is it
really
have.
possible
should
we
have.
didn't? I might
Yeah,
have
you
gone to a
should
school that
have.
didn't have it.
I
You
don't know,
definitely
man. Yeah, that's pretty standard stuff.
should have. Yeah.
Yeah.
Sorry to
Yeah.
those people. Sorry to those people who
No, we do have med students that they're kind of like, okay, I'm just gonna go to school, do what I need to do, and I leave. Which I completely understand. I don't want to get involved with anything. I don't want to know what's going on with anything. I'm just there to get my grade, get my diploma, and keep it moving. I completely understand that part. So
yeah, me, I
Wow.
guess.
You know what, Shay, you're bringing like this grown level of diplomacy to our to our discussion right now, which
Childish
I
antics.
appreciate. Yeah, like we got antics over here. This is what happens when you get older. You like lose all perspective of what's appropriate. So we appreciate you.
of course.
And we're gonna exploit that. So you know what? Let's go ahead and get into it. So we're going into our first segment, which is social rounds. So, this is where we become your life attendings out there because it's become abundantly clear that many of you out there are in desperate need of guidance. And we got the kind of wisdom that comes from running out of fucks. And the question of the week, why is everyone annoying all the time? In which we're going to get into the truth of the generational divide in medical education. This was chosen specifically because you're here, Shay, because I really want to get your perspective on this. So
You
like,
want to know
okay,
what the
so
youths think.
we want to know what these children are talking about. So here's a news flash for you. Francis May and I are old. Some of us are older than others. Okay. Right. And our friends who are now attendings, and they interact with med students, they're almost universally annoyed and disappointed by this current generation of students. Okay. Not because y'all aren't smart. You might be smarter than ever, but mostly because of the approach and attitude with which, like, kids today are entering into medicine. So we've heard them say that students today like have unrealistic expectations of how the curriculum and school experience should be catering to their individual needs. There's lots of requests for like soft excused absences for like mental and emotional health. And there's an unwillingness to like endure the hardships of medical training, which a lot of people feel are necessary, and they feel students feel are unnecessary at this point and feel they might be lacking resilience. And they also feel that it is leading to students entering into training um, far less prepared than people of previous generations. And they also say you guys are kind of obnoxious and don't know how to give appropriate feedback that doesn't feel like a toxic Reddit thread. So like the list goes on. And like as an old,
Tell us what you really think, Tony.
listen,
Like shots
listen, hey,
fired by Tony.
listen, I will not say I'm not an old crotchety doctor, but I'm outside the game right now. It's just what people have been telling me. And that's the only side of the story I ever actually get to hear. So now we've got a real live med student here. So we're going to do the completely fair thing and ask you to speak on behalf of your entire generation, and either set us straight or agree with us. So, Shay, how let's like open it up. Like, how have you experienced friction between your generation and the generation of your teachers?
Yeah. So I think so I'm not a Gen Zer. I'm actually 32 years old. So I'm a little older than most of my classmates. They call me the grandma. Um, but I have to say that I do agree with this generation, or we can say Gen Zers that are in medical school right now, and
Mhm.
how mental health is very important to medical students. I see a lot of doctors and residents and medical students going back and forth online about what used to be, and they shouldn't complain about the hours. They shouldn't complain about the pay and residency. They should just deal with it because our people before us dealt with it. I dealt with it and I got through it and I'm fine. However, we fail to realize that they say that medical students and doctors are some of the number one professions that are dying because of suicide. And if we keep allowing this culture to continue, then we don't know how many people are going to continue to be depressed, anxious, feel like they're not enough, may want to commit suicide because of something went wrong in residency and people talk down on them. They're having a bad day, just all these things. We don't know what people, the kind of span or width span that they have. And we just keep breaking them down in medical school like this is some hazing system. And it shouldn't be. It should be a learning experience. And we should be able to have our mental health together when we leave. We shouldn't be broken down in this system. So I definitely understand with this generation and what they say. We don't want to be like the past. We don't want to
Mhm.
lose people because of suicide. We don't want to lose people because they're burnt out. We want healthy physicians, healthy doctors, healthy attendings so they can be healthy for their patients. And I 100% agree with that. 100%.
Again, I love it. Shay is a vision of just like class and grace about it. Like you said nicely what
Focus.
I have been saying for a long
She's
time,
a
which
vice
is
president, y'all. Just
yes, well,
FYI.
exactly.
That's
You guys
how
can
we
see
got. We
why
got to talk to the people in a certain way.
they did not
She's
let me
got it.
near class presidency and vice presidency for a reason. They didn't let me into politics. Exactly to your point, even when I was in it, which is now almost a decade ago, that I was going through it, and people were like, "That's how it was in my day. You know, this is exactly how I was treated." And so this poor
Never
treatment you're
changes.
receiving,
Yep.
it's legit. Like, it's what we all receive. I received it. And I would be, like, looking at this person, like a older, couple decades older attending, looking at them thinking, "You are traumatized, and you're just traumatizing everyone else. And
Exactly.
you're not like, I don't wanna be like you when you grow up." So if you say, "Well, I got the shit beat out of me in residency training, best wishes to you, you're just experiencing that normal thing right now."
Mhm.
I would be like, I don't wanna be like you. I think that you're doing pretty poorly actually for being a fully cooked adult who, like, still has no, emotional regulation skills or interpersonal skills at all. Like,
Yeah.
we should obviously not replicate whatever made you you.
Exactly. And I seen a story just recently of a resident that said they fell asleep while driving and how dangerous that situation is because the hours is too much. There is no reason why we are working over 80 hours within a week. However, generations in the past did, and they say, well, this is just what it is and it should be that way. I don't understand why you're fighting for less hours or mental health days. Like, yes, we should have that. There is no reason why me as a patient, I would want a doctor coming in that's halfway tired, don't know what the heck going on. I expect them to treat me great.
Mm.
I can't quite understand it. And I think we're fighting against a system that just likes the old ways. And I just hope one day that things get better. And I see things are slowly trying to get better. Like we do have a mental health day built into our curriculum, and I'm hoping that other schools have that as well. But
Is that 1 day per academic year? How does
yes.
that work?
Yeah, so one day per so if we have like a fall semester, we'll have one day built in there, and I believe a spring semester will have another mental health day within there. So two per academic year.
That people can,
Wow.
like, use at their own time and leisure. It's not like,
Yeah.
October 21st is Mental Health Day, like, best wishes, everyone. No, you get to pick.
No,
You
so we
get to
have a specific day out of the year that's for mental health.
wow, just a big 2 days a year, for your
Yeah,
mental
you get
health.
to be well, you get to
That
mentally be at
that is
peace.
that is
Exactly.
something. I mean,
Exactly.
that I guess that's something we gotta celebrate. Okay,
But you gotta make up days you're sick. Don't get sick though.
don't get okay, so
Don't get
okay,
sick.
you can't get
Okay?
sick, you
Gotta
will have
make
to make
that up.
those up.
Hold
Wow.
on,
Okay,
I'm
okay, okay,
dying
okay.
I'm dying at the rate. I had to do okay, again, I'm not a math whiz. I had to hit the Google
Don't
calculator.
hurt yourself.
2
Yep.
days out of 365 times 100 is
What's the percent?
0.5%, 0.54. So that's how much we get to be well, which is an
And
improvement, I guess,
and you
upon
know
our
what? We
previous
are
0
grateful
day.
for it. We must be grateful for it. All right, hold on, because I'm like, okay, I understand, but believe me, like me and friends may understand the urgency of like taking care of our mental health, um, taking care of our sleep deprivation. Like I
Mhm,
am one of those folks who did lots of those drives asleep down a pretty fast highway in Detroit, with regularity. Like I'm very lucky to still be
mhm.
here for a number of reasons. Um, my question though, and maybe you can speak to this, given your I'm not gonna call you a grandma. You called you a grandma, but I think you're just older than the med students right
Yes,
now.
yes.
You're a little more grown, right? Um, the question that I get is like, okay, your hearts are in the right place for the fight that you should be fighting. My question is, do they know how to communicate it well enough?
Um,
That's the whole thing because that's where I see the disconnect
uh,
is like with your staff who are educating you,
mhm,
like they have their perspective. Some of it is like kind of staunch, like you should go through what I went through. Some of it is just, okay, you know, we can give you a mental health day if that's what y'all really want, but I don't know if the 2 mental health days a year are really solving the problem you guys think is solving the problem. You know what I
mhm.
mean? Like, maybe we need to think a little bit deeper. And are we having those conversations, or are people coming at it from, like, maybe a young perspective that is not kind of communicating things in a way that can get things done?
I think that's possibly I mean, I think it could be both. I think that one generation might not be hearing one generation out, and maybe another generation just doesn't know how to kinda articulate how we can go about this in a way of not just talking about it, but actions. Like, I guess we don't give like the steps or actions that we can take to get there. We're kind of just like talking about it. Hey, we need to worry about our mental health. Hey, we need sick days. We need more pay. We need less hours. But how do we go about that in a way where we still get enough training and feel like we're prepared when we leave? So I completely get both sides. However, I think it's also a fight that people have been talking about for a very long time. And I don't know what happens next. Like, what is the next moves for us to even move towards those actions of, making sure residents are protected and medical students are protected when it comes to our mental health.
Francis May, what do you think? You got your thinking face on over there.
Yeah, I was thinking some shady thoughts. I was thinking when you guys were talking about like, this issue of I do agree, and I am a person who very much owns in my 20s, I did not know how to communicate with other people effectively. Like I
Mm,
did not know how to, yeah, just be effective, like get what I wanted or needed from them.
Mhm.
I was very good at maybe like articulating what wasn't right or what wasn't working, but that's it. And then so therefore didn't get a lot of what I was asking for.
mhm.
So I get that, but it's also funny because when I think of like the older generations of attendings who we're talking about on the two sides of this conversation, I think that
Yeah.
some of them are like famously could maybe improve their listening skills and their active listening. Like, so it
Mhm.
is like a circus. It's like the inmates are running the asylum because we do maybe have a younger generation where just genuinely even time and life experience will make them better communicators. They're not maximally effective right now. And then an older generation that just, like, does not wanna hear
Mhm.
or hasn't practiced their hearing,
But at the
things.
same time, I do believe the younger generation is communicating, and I think they're doing it well. We all know what the younger generation wants. We can literally sit here and go down a list of things that the younger generation wants when it comes to protecting their peace in medicine. However, I think just the actionable plan is where it's going wrong. It's like, where is the plan for it? Like, we know what we want. We know, we just want the system to get better, but how do we go about it? I think that's where we can hopefully fix.
In my experience, there's a lot of, like, fragmented players. It
Mhm.
is kind of weird. Residency is just one of the weirdest things in the world where you're, like, still in training for a job, but you are an employee, you're not a student anymore, so you don't fall under student protections. Like, I actually think medical school, my experience was very positive, and I did feel like we had protections. I was at a program that I think does take extra care to, like, make students feel protected. Um, from the resident level, ACGME is here to really make sure that, like, the medical education is sound. I feel like they're commonly a place that people turn to when there's issues in residency, and to an interesting degree, like, you can read the bylines and the mission statements and be like, well, that's not really what they're here for.
Right.
And there isn't an independent agency that handles like resident rights. One area that I have seen make real strides here is unionization of residents. Because when
Mm,
you talk about like, hey, we have a list of demands. This is what is fair and reasonable and safe. We have organized and we're bringing this, to an institution. Obviously, to varying degrees, people have succeeded across the country. I've heard many success stories at different programs where success doesn't mean unionizing, but actually effectively organizing. Of course, then there's some temporality because residency is this weird revolving door that like doesn't happen in other normal workplaces. So even when one
yes.
class bands together and they get organized and they work with leadership and they come up with great solutions, like to your point, they're happy with the outcomes. It's like our needs are met, we're happy with the outcomes. The issue is just those people could always graduate in a non-unionized program. Like you might have to start that fight over again in 3
Yes.
years.
Mm,
Mhm. And just as an FYI to anybody listening to this, we are not saying that Shay Taylor is pro union here. We're not putting
No.
no words in her mouth.
yes.
Her views are her own, and she has not
Yes.
espoused that. That's just what we feel.
Mhm.
So keep that in mind as you put these match rank lists together because I know that can be a hot topic.
Yeah, exactly. And I'm saying, Tony, why not keep your hands clean? Just be like, only Frances May is pro-union. Like, she's kind of a dirtbag, and we do not side with her.
I don't need to keep my hands clean from nobody right now. Listen, I'm down for whatever. I'll be pro-union out here. We'll do it. And Shay will just chill with her fig scrubs. You know,
Yes.
she keep it in the cut over there. We're not gonna pull you out into this. But anyway,
No.
I did want to add like one last thing, and then we can move on. But thank you, Frances May, for like kind of taking us into that because I think that's a really good point. Just kind of the 10,000-foot view. When we get back to the communication between kind of these generations of folks. I think that from both sides, because we have listeners of both ends of the spectrum, right? From the attending side, we can fall into this trap as folks who aren't really even that far removed from where these students and where these trainees are. We can fall into this trap of thinking like, God, like what's wrong with these kids? Man, like, why don't they know how to act? Why don't they know how to talk? I barely understand why they want the things they want. It would behoove you and everyone around you to recognize that like no one's acting irrationally here. And what you want to do is not treat them like children because they are all grown adults. Okay. As much as we want to infantilize them with the system of training that we have, they're grown adults who have very valid perspectives, new perspectives based on how they come up. Like this is the generation of students who went through COVID and lost all this time in school and college or high school and that sort of thing. Like they're coming at life with a very different perspective on what's possible for them and what they should expect. You need to embrace that if you want to call yourself an educator, because that's what being a teacher actually is. And when you're a student and you're coming up, you have to also remember that you're not a kid in this. You're not a child. You are an adult. You have to think in order to be heard by the folks above you. You have to think like a colleague. Okay. Like the easy thing when I think about when I was in school and we would have demands on like student council, we know how to make complaints, but we don't know how to get to a table with anybody. We don't know how to think ahead. Okay, what's a solution that will make sense to them based on what I think, where I think they're coming from. You're kind of treating them as parents when you got to think of them as colleagues. And I think if the two sides are approaching it that way, then maybe we got chances to do a little bit better. And that's my 2 cents on that. But we'll move on. Because there's a lot of strife.
That was like Tony's dad's corner, which was like,
Tony's dad's corner.
You guys better figure out a way to get along.
I've been around these kids too long out here.
But it makes
trying
me
to tell
think
them.
of like how many generations go by that like, well, this generation is this young kids, they want change. This generation want change. There had to be changes because medical school changes ever so often, every few years. So there has been students that fought against the system, and there was a generation that before then it was like, well, this generation don't work. They don't want to do it. They want to make change.
Yeah.
It's the same cycle.
It's the same thing. Same cycle. And just
it's generation. So
yeah, it gets real easy to forget that we were that generation that was making noise. Real easy.
Yeah. And just like you're boring. Like come up with a better insult for the newcomers and the young kids. They just say they don't want to work. People don't want to work anymore. Kim Kardashian and all attendings.
Everybody. Well, getting slightly changing gears. I want to take us into our next segment that I'm just calling outsider advice, because I think you're in a great position, Shay, to help us out with this one. So I think we can all agree that medicine is better for having doctors from many different backgrounds, coming from non-legacy families, ethnic, cultural, and socioeconomic groups that are underrepresented. But for many of us from those backgrounds, we tend to erect barriers ourselves to what we can be. Like we create ceilings and count ourselves out of contention. So, like, for example, when I would talk to a lot of Black students, like college students, high school students who had an interest in medicine, even though they had an interest, the first thing they would say is, I can't afford it, or I can't take out loans. Like things like that. So they would give up on their dreams before they even got started. Um, and so I want us to think, because like each one of us came from, backgrounds and families where this wasn't, a promised profession. This wasn't a promised life for us, right? So I want to know, like, what advice can we give to the kids who are on the outside looking in right now, and they still can't quite see a version of their lives where they could be wearing the white coat, or they could have the monogram figs. Um, so yeah. I don't know, Shay, you have any thoughts?
Of
Anything that?
course. I mean,
Yeah, go
that was
for it.
me at one point, from my story. I didn't grow up with any medical doctors in my family. I'm from an area in Connecticut where you don't really see too many Black doctors. Now you do, fortunately, but when I was growing up, you didn't
Hmm.
see too many. So I didn't know
Hmm.
that was possible, of course. Um, I think the biggest thing, and I know it's like hard for all of us to get in the community because not many of us, but I think mentorship is the biggest thing that can really change somebody's perspective. Because if you don't see yourself or you never see yourself in those positions, it's hard to kind of see yourself doing it.
Hmm.
And I didn't have mentorship till later on, and that changed completely the trajectory of like my whole career and where I was going, and just being able to see myself as a doctor. I think if we can increase the amount of mentorship we have with these students and allow them to see it and know the life and how to get there, I'm hoping that can help a little more. I
Hmm.
know that's easier said than done because it's just not many of us to mentor every single person.
Yeah.
But if I can talk to those students and if they are listening now, I would tell them that looking at my story from going from a hospital janitor to going here and having nobody in my family, as cliche as it sounds, is possible.
Hmm.
It is 100% possible if you put in the work and you know that, every step of the way, whether you hear a no or a closed door, you keep on going. Like, 'cause I
Hmm.
had so many closed doors, so many people who said no, so many people say you possibly can't do it. However, I just kept going on to the next door, knocking at the next door, and keep going until I got here. So I know it's so cliche, but just keep working and keep going at it and just know the vision.
Hey, cliches are a thing because they come from the truth.
Yeah.
But I do wanna drill in just a little bit more, because you said you had a mentor who changed everything.
Yeah.
But I want to talk about the moments before that mentor came around.
Mhm.
Like, because I think it might be powerful for folks to hear, like, okay, what were the stories you were telling yourself about what you
Mhm.
could be before you had someone who you could, you know, see this different sort of future with?
Yeah, so when my mother got sick, when we were at Yale Hospital and she went through the health disparities that she went through,
Mhm.
I knew at that point that I wanted to do something within the healthcare system. I didn't know what it was. At first, I thought it was nursing. Then I thought it was like politics. I wanted to just change the whole world at that point. I was like, I have to do
Mhm.
something. So let me figure out what I could do. And that's when I started to figure out like, hey, I could just be that doctor that, I felt like wanted to be there for my mother at that
Mhm.
time. So every point in my life before I started to apply for medical school, I just told myself, like, hey, this is the reason why you're doing it. You're doing it for women that are like your mom, who may not have that voice or that person that's there that talks for them, or they may not know the medical system. This is who you're doing it for. So I had to remind myself every day because it's hard if you don't have mentorship. It's hard if somebody doesn't know how to go through the application process. So I had to remind myself every day why I was doing it. If you don't know your why, there's no way you're going to get through this process. You can't just say, oh, I want to do it for money. Like, there's a million ways to make money out here, million easier, faster ways to make money.
Mhm.
However, you have to have a why to why you're doing this process, and it just make it that easier to get through it, and not give up, of course.
I mean, Franz May, I'll be honest with you. I mean, I was gonna like maybe we could say a little something here and there, but I was like, she kind of
Make
just
me
did some
look dumb.
preaching right there. I was like, no, I was just like, I could just go out right now. Like she just
You
came
can
in
do
here and
anything
just
now,
yeah,
anything
I
you
was
want to
like,
do here.
I'm feeling empowered. But yeah, no, go ahead. Go ahead. What do you
No,
got?
I definitely I really appreciate you sharing, with us live. Like I know your story has been in the news and it should
Mhm.
be it should stay in the news. Like I really think it's
Hmm.
incredible that you're sharing your journey. You almost made me cry. That's why. So again, if anyone wants to comment and they're gonna say Frances May and her resting bitch face, it was going crazy. I was just trying not to cry. So just, back off. We're just sitting here,
Back
we're
off.
listening to Shay's
Yeah.
powerful words. It's very inspirational. And like, I'm in my 30s. I think that you're calling out the why. I can actually interestingly, like I can relate to some of that now because part of my why in the work I do, what we do at the Hippocratic Collective is like I actually do think it's really important to empower and give a voice to people in medical education. I just like know what it takes to become a doctor. I know you talk about, seeing what your mom went through and wanting to be the doctor for your mom. It's like I almost want to be just the person for those doctors who don't have their own voice because of course like a lot of people in training don't feel like they can be authentic or have a voice or speak out against things in the system that are just not working. So again, I find it relatable. I think that also as a first doctor in the family, like, um, if I could go back, the only thing I would do differently is I like a lot of this rhetoric in 2026 of like, I'm chasing 1,000 rejections this year. I'm chasing 100 rejections this year. I'd like 1,000 is a lot, hopefully, but you never know. I might be chasing my 1,000 rejections this year.
Mhm.
That though is so freeing to me, and it's a much healthier mindset than the one that I had when I was a kid, which is like one no or one setback is going to break my heart into a million pieces. I may never recover from this heartbreak, right? Like it's if you flip it on your head, and it sounds like you have a lot better perspective about it, that's that's the growth mindset. Then that's actually how I think people find great success in whatever they choose to do.
Uh-huh.
Hmm.
Uh-huh.
All I would add, um, to both of you guys, I love that we're getting inspirational, this episode. It's refreshing.
It's not us,
Um,
it's
it's
Shay.
not
That's
yeah,
the
it's
only thing
Shay.
that's
She's
different.
pulling it out of us. It's very weird. I feel very uncomfortable. But all I would add, to, knowing your why, because knowing your why can actually be a pretty challenging thing, before you really know yourself. And so, one thing I actually started doing this a little more this past year, um, was taking that knowing your why a little bit further, with this exercise that I started doing called 5 Whys. And so that's to say, when you come up with a why, generally it's the easiest why you can think of. It's the one that rolls off your head, right? Like the most common why med students will say, like, why do I want to do this? Oh, I want to help people. Um, Ask yourself why again. Why do you
Mhm.
want to help people? Oh, well, my mom got really sick, and I want to help people like her. Well, why?
Mhm.
Well, you know, uh, I really like going through that process with her, I really started to understand, the power of being there and like practicing empathy right there with somebody. And that's something that I feel is really core to who I am. And now I see a place and a profession, where I can do that. And if you can go even deeper, ask yourself why again. You know what I mean? So keep going deeper so that you get to a why that is not external. It does not change with what goes on around you or what other people do. It's something core to you that will
Mhm.
not change. Okay. And is specific, so that's the thing you can really come back to. And that's a why that won't go away. Um, and so
Mhm.
that's something I found, over the course of this year, now that I'm in my lovely 40s. I start to do these things.
I know.
Um,
I really love that idea because it becomes very personal to you. Like
Hmm.
this mission became so personal to me at that point because I
Yeah.
felt the pain of my mom, right? Like you said, it becomes internal. I felt the pain of other, women of color who might be in her shoes as well. It became this personal mission for myself to get there.
Hmm.
And I want to let everybody know it's just not that easy to change the system. I'm not saying I'm going in there as superwoman and the whole system about to change, but sometimes it's a doctor at a time that can bring that refreshing spirit to medicine, and you just go in and they be like, oh, this is the first doctor who cared about how I felt or who asked me how I'm doing or, who look like you and just understand me. So it's just one patient at a time can really just change, people's perspective of medical doctors. So I definitely love how you said, just keep it personal to you. And that could be a reason why it's something personal.
Yeah. Another successful and legendary episode of Social Rounds comes to an end. Shay Taylor, thank you so much for
Thank
hanging
you.
with us. You have
Thank you.
you've made us believe in some things again. I think my heart grew three sizes today.
I see. Thank you
She's
for
just like,
having me.
where am I?
Yeah, Shay's just like, I just kind of do this. This is how I talk. Anyway, but thank you again. And Frances May, please take us out.
Yes, thank you. I don't have a heart, so my heart didn't grow any sizes, but loved having you here. Still very inspired by you. If you enjoyed this episode, please subscribe, rate us 5 stars, and leave us a review. Check out our website, hippocratic-collective.com, for more shows and content like this. Thanks for tuning in, and we'll see you next week.
Bye.